Hi, I'm Marthel Neville. Time now for Sunday House Call.
And I'm Eric Sean. Welcome as always. Joining us, Dr. Mark Siegel, professor of medicine at NYU's Langone Medical Center, is also the author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health.
And Dr. David Samadi, chairman and professor of urology at Lenox Hospital and chief of robotic surgery. Good to see both of you,
Nice
doctors.
to see you, doctors. So happy Sunday to you. We're going to start with actually something that's not that happy. It's a shocking new report. It shows that 1 in 5 of American kids, or about 20% of our kids, they have unhealthy levels of cholesterol. That number is even worse, it turns out, for obese kids, with more than 43% of those showing what they call dangerous cholesterol levels. Teenagers, it turns out, has the worst cholesterol levels. Nearly 27% of 16 to 19-year-olds face that condition. Many studies have shown heart disease can start with artery clogging blockages, sometimes as early as 3 years old. Dr. Siegel, how bad is this issue when you got 20–25% of our young people already having these cholesterol problems?
This is a huge issue, Eric. And, you know, people come in to see me at the age of 65 with a sudden heart attack. They say, how did I get that? Well, they started very, very young. And studies have shown that kids can start to build up fatty plaques in their arteries, their coronary arteries that feed the heart, as early as the age of 5. This is cholesterol plaque. It's bad cholesterol plaque, known as low-density lipoprotein. This stuff sticks to the inside of arteries, Eric. It sticks there. And the only way you can get it off, by the way, is with something called good cholesterol. High-density lipoprotein is like a detergent that literally cleans your arteries and transports the bad cholesterol out of your body. But you know what they're finding among these kids? And you noted the big headline here, 43% of obese kids have this problem. They're finding that they are low in good cholesterol and high in bad cholesterol.
But wait, Dr. Siegel, you mentioned something. You said there is like something that's kind of like a dishwasher detergent, if you will, to clean out that, to get rid of the bad cholesterol. What is that? That's
the good cholesterol. That's the high-density stuff.
So how do you get that up?
Well, you get that up by exercising. You get that up by losing weight. You get that up by improving your diet. If you're older and you're a smoker, you get that up by stopping smoking. But the key here is exercise and lifestyle change. And when you're talking about children, that's what we have to start with. In the vast majority of cases, this can be addressed by diet and lifestyle.
Dr. Samadi, I know you love to talk about prevention, as do I. I'm at the airport. I see a young kid who's chunky snacking on a bag of chips and this and that, and you see other kids where the parents give them carrots to snack on. I mean, there it is, right?
Yes, absolutely right. And I think that if you look at over the last 3 decades, we are absolutely heading the wrong directions. Our children are heavier. The rate of obesity, as you mentioned, is on the rise among teenagers and young kids. And a lot of parents, they think that they're actually doing the right thing because they're eating their food, they're getting stronger, and they will snap out of it, or this will go away. And
the baby fat will go away.
Exactly right. And we're finding out that 75% of the time, it won't go away. And whatever you do when you're the age of 2 years old and 5 years old, and that behavioral habit will continue as you're getting more into your adults. And that's one of the reasons why adult obesity doesn't really start when you hit your 40s and 50s. It starts when you're much younger. There was a great study done by this Bogalusa heart study. Bogalusa heart studies, they look at thousands of children out there, and they find out that your body mass index, your exact point, your obesity, the amount of food that you take, and how you grow over those curves that the kids had, is very relevant to forming those plaques. Some of them, they call them fibrous plaques. That's a prerequisite to get this atherosclerosis or heart attack and stroke. As you get older, they continue to do this. So big question comes for the parents out there. When should you go to the doctor? When should you screen? And this is a big debate. I think if you have something called family history, there's something called familial hyperlipidemia, meaning that it doesn't matter what you do, you have the genes, you have this autosomal dominant or genetic component to this, where you're going to get the high triglyceride and high cholesterol.
So what do you do? I mean,
go to the doctor and check the cholesterol at the age of 2. Wow. 2 years old. Most recommendation is between 8 to 10 years old. That's when you want to know. And the reason is exactly what Dr. Siegel just mentioned, because when you interfere with that, exercise, better food, portion control, changing their habits. I mean, they have no business to have French fries and burgers.
Should you have statins at that age?
Eric, the American Academy of Pediatrics says that you should start screening at the age of 9. From 9 to 11, you check cholesterol. Then you do it again from the age of 17 to 21. We both believe that knowledge is power, so I'm not going to put an age on that. I agree. I don't know about 2, but I agree with David. The earlier I know this information, the better. And then I can do something about it. Even lifestyle change, the stuff we've been talking
let's say
about.
you don't eat the fries, you don't eat the fried stuff.
Nothing works.
Wait.
I want to answer your question, though.
Go ahead.
If nothing else works, and you have other problems like high blood pressure as a child and diabetes as a child, you might actually consider using medication.
Okay, hold on.
It's a very
Last
good
thing.
point,
Is it
actually.
not over the top because the kids aren't moving? That's the deal.
Yes.
Here's the
Yes.
deal. I ate a whole bunch of junk food when I was young, truth be told. But I moved and moved and moved.
So another great
it's
study,
exercise.
that's right, another great study came out that said that teenagers are not moving, our children are not moving.
They're
A lot
sitting
of it has to do with
on
what's
the
going on.
iPad and they're sitting on the thing all day.
But the other thing is, like, look at the cholesterol. Cholesterol is actually a good thing, okay? You need cholesterol because, yes, your cell membrane, your hormones, it's the foundation of what we do. 75% comes from liver, 25% is what that kid was doing at the airport, and the parent is saying, like, stop it. They should teach them. You should cook at home instead of keep ordering this kind of stuff. If the LDL is over 140, these are the numbers you want to know. If your bad cholesterol is over 140, if your good cholesterol is less than 40, and the total cholesterol is over 200, call either Dr. Siegel or call a cardiologist. You got to take your kids for a checkup.
And the message here is for pediatricians, because if a pediatrician is seeing a child with an LDL of over 120, 130, 140, or an HDL, HDL is a good cholesterol. That's the stuff I'm calling detergent, Arthel.
Okay.
The detergent cholesterol has got to be over 50 or 60. If you're exercising, you still can bring it up. Your point about being sedentary is a great one, because it's not just 30 minutes of being off the couch. It's a whole day of being active. And those iPads and those iPhones, and they're starting that at younger and younger ages. The younger you start with your iPhone, the earlier I want to check your cholesterol.
Well, it's a culture change, and you've got to, like, really change their behaviors.
Okay.
And also this juicing
We
business,
have to
that's
go.
another
They
bad
just told
thing.
us, like, you have
gotta
to
go.
go. So
Great
coming up,
advice.
it was great, yes.
Go deal with your kids, please. Get it early.
Change their diet.